This is Jefferson Close-Up, and I'm Carol Celine. My guest today is Dr. Reginald Ho. Welcome. I was pretty jealous to learn that you grew up in Hawaii and you spent your childhood going to the beach and snorkeling. That must have been just wonderful. You came to Notre Dame, though, for college, and something pretty exciting happened to you there. Tell us about it.
I walked onto the football team and became the starting kicker for the Notre Dame football team. And my senior year, we won the national championship, which the last time that they won a national championship. So it was a very, very exciting time.
Why did you become a doctor?
I enjoy taking care of people, and my father was is a physician, and he helped me learn practice in terms of making people better, and I enjoy science.
Now, what would you say is your greatest achievement?
My greatest achievement, I think, is raising my two boys to be good young people. Yeah.
And what's your favorite way to spend your free time?
I enjoy spending time with the family. Going on vacation with the boys and my wife, of course, and just having a good time with them.
What would you say gives you the most pleasure in your work?
I really enjoy seeing people get better. When they have a problem with the heart rhythm and they get corrected and they feel a lot better, that is quite rewarding.
You are a cardiologist with a specialty in electrophysiology, kind of an electrician of the heart. In fact, you actually wrote a book on electrophysiology. Explain to us what it is you do.
Sure. I deal with people who have heart rhythm problems, whether it's too slow or too fast, and correcting it so that they feel a lot better.
Now, one of the most common heart rhythm failures is known as atrial fibrillation. Mm-hmm. What is that?
That's when the heart rhythm goes chaotic in the upper chambers, and it can cause people to have symptoms, shortness of breath, and it can cause strokes. And our job is to try to prevent atrial fibrillation from occurring with either medicines or ablation to help them.
So what do you do to diagnose it?
Yeah, so many times we'll do monitoring. For example, if it's a very sporadic rhythm, we could put a monitor on them to see exactly what the rhythm is and correlate their symptoms with their rhythm.
Oh, that's a monitor that you wear at home for a couple of days?
Yeah, so they're wearing a monitor, it gets sent to another station, and that station sends me all the information so I can correlate what's going on with their rhythm.
Now, you mentioned earlier the word ablation. That's one of the techniques you have for correcting irregular heart rhythms. That's kind of new, isn't it?
It's been around for maybe about 30 years now, but the energies that we use has changed and it's been with us. We use radio frequency energy to cauterize the heart in certain areas that is responsible for the fast heart rhythm, so they don't have it anymore.
Are pacemakers used for this problem?
Pacemakers are used for patients who have slow heart rhythms to speed up their heart rate and get it back into a normal range. And ablation and defibrillators are for people with fast heart rhythms.
Now, Jefferson has quite a program here in electrophysiology.
Yeah, so we have a very successful electrophysiology program. We do all the different ablations that are available, lead management, extractions, and pacemakers and defibrillators, and a very comprehensive program that I'm very proud to be a part of.
Do you encourage your patients to ask you questions?
Oh, absolutely. I think that's part of the process of medicine, is to having a good rapport that they can trust you and you can give as much information as you can so they feel comfortable with what's going on. It's very tough for them many times.
It's a nice way to live. Thanks for being here.
Thank you.